All right, Sanu, you ready, Steph?
I'm ready.
Hey. Hi, guys. Welcome, everyone. Thanks for joining us today. We've got a great presentation with my brain guru gal, Stephanie Ramirez. She has done so many things for us here in community health and wellness. My name is Bree Kimberling. I am an RN here at North Kansas City Hospital, and I work here in community health and wellness. But yeah, we've got a great presentation today, long haul COVID in the brain, what we know now. Stephanie is our presenter. A little bit about Stephanie is she's been practicing speech language pathology since 2009 in various settings, primarily focusing on acute care and outpatient rehab with adults. In February of 2021, Stephanie founded the Virtual Brain Injury Support Group through North Kansas City Hospital, which meets monthly and has served over 45 individuals from Missouri to California who are recovering from concussions. She is passionate about sharing information with the community and has been a featured speaker at several conferences, including the KU Concussion Symposium, STEM Saturdays at Union Station, and the Kansas Speech and Hearing Association. Stephanie enjoys spending time with her husband and two children, Owen and Mia, and rooting for her alma mater, the Oregon Ducks. So welcome, Stephanie. Thanks for joining us. And I'm going to turn it over to you. I always forget to do this. Chat is open, so please throw your chats in there and Stephanie will answer those at the end. All right, enjoy.
Thanks. Sounds good. I will share my screen here. Give me just a second. All right, and we are going to get going. All right. So yes, thank you guys so much for coming. This is definitely an area that I was very interested in presenting on because research is coming out and changing all the time. Literally was just adding in some information this morning. So trying to get you guys the most up-to-date research on long haul COVID-19, how it affects the brain. And I think this is just really good information for everyone. So very excited to share with you. So the plan for today is we're going to first start by defining what is long COVID, how do you get diagnosed, what are the symptoms, how prevalent is long COVID. We're going to then move into talking about some management strategies if you or a loved one are currently dealing with long COVID, and hopefully give you guys some great resources and just different ideas for ways to get support. We definitely like to share information so that patients know that you are not alone, that you have lots of resources available out there. And so hopefully everybody leaves today with some good tools that they can put into place. So first and foremost, what is long COVID? So to talk about long COVID, I want to take a little walk down memory lane here, probably to a time that most of us would like to forget. But starting back in December of 2019, the first case of atypical pneumonia-like illness was reported in Wuhan, China. And by January 7th of 2020, the public health officials in China identified the novel coronavirus as the cause of this outbreak. In January 2020 as well, later in the month, the CDC reported the first laboratory confirmed case of the coronavirus in the United States in the state of Washington. And on that same day, they activated the Emergency Operations Center to respond to an emerging outbreak. Fast forward to March, we all remember that was when everything shut down. We had the World Health Organization declare COVID-19 as a worldwide pandemic. By June of 2020, the number of confirmed COVID-19 cases in the United States surpassed 2 million. And then just 6 months later, we had more than 1 million COVID-19 vaccine doses that were administered in the US in 10 days. So just from March to December, we had, tons of research happening. We had the vaccine development and rollout, so much going on. And then fast forward to about a year after that, October 6th of 2021 was when the World Health Organization published a clinical case which first defined post-COVID-19 condition or long COVID. So about 2 years after the very first cases of COVID were discovered in China, we were discovering this long COVID illness as well. So as of April 2024, 5.3% of all adults in the United States, which equivalates to about 17 million adults, reported having long COVID symptoms. So huge numbers. What we found over the years was that more than 40% of COVID patients showed brain symptoms at the outset. So things like brain fog, fatigue, poor attention, difficulties with memory, things like that. About 20% of COVID-19 patients still reported cognitive changes weeks after they recovered from the virus. And early studies and studies now also aren't showing really any correlation between severity of disease and long haul symptoms. So even if you have a really mild case and you recover well, you may still develop long haul COVID. So this is just a graphic from the National Center for Health Statistics. The percentages of people who have ever had long COVID versus currently have long COVID. So you can see, again, right now, about 10% of people who have ever had COVID are reporting those long COVID symptoms. And about 30% of people are reporting that they have ever had it. So these are also symptoms that lasted longer than 3 months. So something to keep in mind. So how do we know? How do we know if we have long COVID? Getting a diagnosis is actually a little bit more tricky than you might think. You actually don't even need a positive COVID-19 test to be diagnosed with long haul COVID symptoms. All you have to do is have the symptoms of COVID, a potential exposure of COVID, and it really is a diagnosis of exclusion. So the doctors have to go through and do a detailed health history, go through and say, could you have possibly been exposed to COVID? And then do a health examination. They might do blood work, they might do imaging, to really try to get a clear picture, because there's a lot of different illnesses that can present similar to long COVID. So they have to kind of rule out all of those before you get the diagnosis of long haul COVID. Long COVID or COVID-19 is also possible that it may help uncover diseases that a person didn't even know they had. So what we're seeing is that patients who maybe already had some kind of dementia starting potentially, they didn't recognize the symptoms yet, but after having COVID or having long haul COVID, they're then getting the diagnosis of Alzheimer's disease or dementia. So some of those diseases are coming about. And again, I think we're going to talk about research later. One of the things that researchers are working towards is a more definitive way to test for long COVID. But right now, it is a diagnosis of exclusion, and everyone presents a little bit differently. So you really have to work with your doctor to make sure that they're getting all the information they can to make an accurate diagnosis. And why is that hard? Well, actually, studies have reported over 200 symptoms associated with long COVID. So today we're really talking about COVID in the brain, so I wanted to highlight those. But it's important to remember COVID-19 was initially identified as a respiratory virus. But what we are finding is that the effects on the nervous system have been profound. Even in the initial phases of the pandemic, what we were seeing was that having COVID-19 actually increased a person's chance of having a stroke, even if they were relatively young and had lower risk for such events. So from the earliest stages, we've been really working diligently to try to, as a country, to try to do research and figure out how COVID is affecting the brain. But some of the symptoms that I commonly see in my patients who I am seeing for long haul COVID are things like changes in sleep. A lot of people report chronic cough, fatigue, and that can be mental fatigue, it can be physical fatigue, headaches, anxiety and depression, and then that brain fog that we are really seeing a lot of. So patients a lot of times will report challenges with memory. They feel like they have trouble concentrating. They feel like thinking is slower or more effortful. And so that's typically what I work on in therapy as a speech pathologist, is kind of dealing with that brain fog. But when we look at the symptoms, brain fog is second only behind fatigue as the most commonly reported neurologic symptoms in COVID-19 patients. So you can see, a lot of other symptoms there, but brain fog is definitely one of the most prevalent. And so then the question becomes, why? Why is the brain and the nervous system so impacted by COVID-19? And, the impacts actually are pretty relevant here. So I wanted to include this as well. This was the percentage of adults reporting that they have activity limitations. So their symptoms are preventing them from doing the things that they normally would do. 4% of all adults report activity limitations, and the people who currently have long COVID, a quarter of them say that their day-to-day activity level is impacted. So these findings are really relevant. And so when we're thinking about the brain and we're thinking about COVID-19, one of the initial things that researchers were looking at was, does COVID infect the brain directly? Is it a direct infection? And from what I've read is mostly that has been disproven. What we do see is that it inflames the brain. So there's inflammation. And basically inflammation can be thought of as a flood of immune cells and chemicals that the body releases against intruders. So, when we get sick, our body kind of sends out these cells and things to help protect us and kill off whatever's going on. Well, that happens when we have COVID as well. And one of the things that they saw was specifically there was increased immune activity in certain parts of the brain. One of them being the olfactory bulb, which you can see in the picture there on the right. And that, of course, is involved in our sense of smell. Well, what's one of the telltale signs of COVID? Loss of smell. And so when we think about that area of the brain, once that inflammation kind of gets in there, it is a direct access to the rest of the brain. And it can be, kind of that gateway for that inflammatory response to affect the rest of the brain. Now, normally, we have what's called a blood-brain barrier, where there is kind of this, guard against kind of this inflammatory response getting to the brain. What we found was that the blood-brain barrier that separates the brain from the rest of the body and keeps it safe actually can break down during a COVID-19 infection. So One research team found this barrier is more permeable in people with both long COVID and brain fog than unaffected people or people that have long COVID but not brain fog. So that kind of points to that route for those immune molecules to enter the brain. And the article that this was published in Nature Neuroscience actually had this graphic on the left where it shows the pink areas where there was tissue damage in the brain of a person that had COVID-19. So all of those kind of immune molecules can kind of come through that leaky barrier and get to parts of the brain that normally would not be affected by a virus. Now, it might not just be inflammation that impacts the brain, although that's one of the main things. Metabolic encephalopathy is actually caused by a chemical imbalance in the blood, and that can be caused when organs are not working as well as they should. So when patients are sick and their organs aren't functioning the way they might normally, then you might have this metabolic encephalopathy. Maybe the brain doesn't get enough oxygen, or the organs change the balance of chemicals in the brain. That can cause a lot of changes in the brain. Also, as we talked about earlier, COVID-19 can lead to strokes, a tendency for clot formation, and that can block the blood flow and oxygen to the brain. So that will certainly impact someone's brain function. Going back to some more inflammatory syndromes, things like acute, okay, this is quite the vocabulary term here. Acute disseminated encephalomyelitis is when inflammation affects multiple areas within the brain. When it's severe enough, it can actually cause bleeding in the brain. You can have inflammation in the spinal cord that leads to transverse myelitis. You can also have inflammation that affects the motor nerves that can cause Guillain-Barré syndrome. And in children, inflammatory processes affect multiple organ systems and can cause multi-inflammatory syndrome. And that's in children. And so, it's important to watch children as well and kind of how they are recovering from COVID, because they can actually also be impacted by long haul COVID as well. The nice thing is that a lot of these can be targeted with drugs that target inflammation. So if you get in to see a doctor, there is a good chance that they can help with a lot of this. So a lot of what we just talked about is pretty scary. I mean, nobody wants to have those things happen. And we did talk about before, anyone can get long COVID. It's really not impacted by how severely you've had the illness. But we have found that, long COVID symptoms can be more prevalent in certain individuals. And mostly it's just because these populations generally have a higher level of COVID-19 infection. So if you are infected with COVID-19, you have the risk of long haul COVID. So people in racial or ethnic minority groups, socioeconomically disadvantaged populations, people with disabilities, they all have a higher risk of COVID-19 infection to begin with. We really don't understand fully the impact of COVID-19 on people that already have neurological disorders like Alzheimer's or stroke. One of the questions I get all the time, because I work with those patients, is, do I have a higher risk? And we really don't know right now. Some data suggest that these populations might have worse symptoms. The connection's really not fully understood yet. So I would put a question mark by that one. Other people that may be at higher risk of long haul COVID, women, people of Hispanic or Latino descent, people that have other underlying health conditions such as heart conditions, diabetes, adults who are 65 and over. And then again, people who did not get a COVID-19 vaccine who have less immune protection from the virus itself. So how can we prevent getting COVID-19 initially so that we don't get long haul COVID? I think first and foremost, we can stay up to date on our vaccinations, always practicing good hygiene practices like hand washing, using air filtration systems at home and at work to try to get cleaner air. And then if we are sick, trying to use precautions to prevent spread. And if you do get diagnosed with COVID-19, going to see your doctor quickly so you can get treated and prevent severe illness. So let's say, you already are having symptoms of long haul COVID. How can we manage that and make quality of life better? I think the first thing I want to highlight is that long COVID is really different for everyone. And so people who are experiencing long COVID might find different activities, treatments, strategies helpful. So I'm going to provide you with some that I have personally seen used with my patients, but you should use whatever strategies work best for your health and talk to your provider about, personal medical management to help you improve your personal symptoms. So going off of that, first and foremost, I think you need to talk to your doctor. Don't suffer in silence. Don't try to, just push through. If you're having significant symptoms and you suspect long haul COVID, you need to talk to someone. It can be difficult because I think it's hard to explain sometimes what you're going through. Your symptoms, they might be misunderstood or not seriously, believed, maybe by family or friends because you look the same. Why do you feel so different? You might feel like there's a stigma also kind of associated with those symptoms. But it's really important because you want to get that diagnosis to get the help that you need as quickly as you can. We already know that it's going to be kind of a process, right, to diagnose and exclude all of those other conditions. So I really liked this graphic from the CDC. It was kind of how to prepare for that first appointment that you're going to have with your doctor. Main thing is that you're going to want to make sure that you write down all your health history, your medications, and that it's always a good idea to have a family member or friend go with you to the appointment so that you have someone there for support. And write down your questions so that you can, ask those of your doctor and make sure that you get all of your questions answered before you leave. Those are the main things. And then make sure that before you leave, you're clear on what the next steps are. What tests do I need to go have done? What medications are we changing or adding? When am I going to come back and see you again? Because I think it's going to be an ongoing conversation. So it's not just going to be a one and done appointment in most cases. You're going to have to go back and really kind of make sure that you follow up on that treatment. One thing that your doctor might recommend is working with therapy. And, you might not think of that first off when we're thinking about COVID or the need for therapy with COVID, but we have seen a tremendous increase in referrals for physical therapy, occupational therapy, speech therapy, for patients who are dealing with long haul COVID. So physical and occupational therapy are going to work with you on that fatigue management. Some patients really complain of vertigo, so they can work on that, kind of building up your endurance for physical activity. Speech therapy, which is what I do, we work everything with the brain. So we are going to be doing cognitive training, strategy training for endurance. We're going to be doing brain health, symptom management strategies. So, how do you manage the insomnia? How do you manage the headaches? How can we help work through that? Also within our scope of practice, patients may have changes in their voice. They may experience chronic cough, maybe some swallowing issues as well. So we can also help them with that. So, you're going to go through for therapy a pretty detailed exam. You're going to, we're going to talk about your symptoms, your history. We're going to look at your balance, your hand-eye coordination with physical therapy and occupational therapy. We're going to do a cognitive assessment for speech therapy. And, we're going to talk about other areas where you might need help. And so we can help get those referrals going as well. Some of our patients need to see cardiac rehab, pulmonary rehab, gastroenterologists, psychologists. So we really try to make sure that we, treat the whole person and that you're getting as much support that you need to navigate through. The next thing that I would recommend is talking to, a counselor, finding a good support group, people that are going through the same thing. As Bree said, I founded the brain injury support group here at North Kansas City Hospital, and I have seen firsthand the benefits of connecting with others who are going through similar experience. You can learn from one another. You can have that sympathetic ear. And so I would really recommend, looking into that. COVID and long haul COVID can really affect quality of life. It can lead to things like sadness, worry, low self-esteem, frustration, anger. And our emotional health is really closely tied to our cognitive health. You can't really expect your brain to do higher level cognitive things when you're in this fight or flight mode. So I actually find that patients that go to counseling do better with my therapy. So I listed here a few of the larger support groups that you can look into. And I would just encourage you to do, a search and see what's out there, because actually the resources that are out there are definitely growing. So definitely time to, get treatment for things like anxiety, depression, and make that part of your plan. The next thing that I would definitely suggest is practicing self-care. So, you can speed up your recovery from COVID and long haul COVID with lifestyle changes. One of the things that we talk about in therapy is pillars of brain health. So things that are going to help your brain be healthier and happier overall. And so number one, having a healthy diet, can help your body recover faster. Some people and studies recommend a Mediterranean diet that helps to reduce that inflammation that we were talking about in the brain earlier. So, eating a lot of leafy greens, vegetables, nuts, fish, fruit, and really avoiding those foods that we know trigger inflammation, like fried foods, carbohydrates, sugar, processed meats, things like that. A dietitian would be a great resource as well for someone who's wondering how to reduce inflammation through diet and ways that they can do that safely. Another one is, engaging in regular exercise. So a lot of times what I tell my patients is heart health is really closely tied to brain health. So anything that you're going to do that's going to be good for your heart is going to be good for your brain. Now, with COVID, it's a little bit tricky because sometimes getting back to regular exercise can be challenging because it triggers some of those symptoms like shortness of breath, coughing, fatigue. So you really need to structure your exercise plan and really listen to your body and just increase that intensity over time. You can't jump right back into what you were doing before. And that's, again, where a physical therapist can probably help guide you in what you're doing. It doesn't have to be difficult. You don't have to go out and run a marathon. Sometimes just 10 minutes of stretching or yoga can help start that process and kind of wake your body back up again. Staying mentally active, that's what, we do in my therapy is working on things that are going to help with attention, executive functioning, language, processing speed, memory. We do exercises that are going to challenge your brain. I always tell people, you should do one thing at least every day that's going to make your brain work and make you think. We get into sometimes a rut or a routine, and then our brain kind of gets lazy. So we definitely want to make sure that we're engaging in mental activities. So, learning something new, doing mental math, starting a new hobby, all of those things can be really engaging. It doesn't have to just be like puzzle books, crossword puzzles. You can get really creative with it and make sure that you have something that's really fun and engaging. Staying socially active, definitely patients that have long haul COVID are at more risk for social isolation just because of the symptoms and those not being very conducive to engaging in social activities. So a lot of patients just prefer to stay at home. But it is really important because if you do it the right way, then it can really help stimulate your brain and make you just feel good, right? So maybe instead of going out to the restaurant that you used to like, the music's really loud and, you got to yell to be heard, maybe you just go to like a quiet coffee shop or like you go to someone's home. Maybe you, just talk with your friends and let them know what you're experiencing. And maybe they can even come and help you. And if you're going to be going to something like a big event, like a wedding or, a big holiday that's coming, planning ahead to make sure that you're successful. And you're doing everything, you're anticipating maybe some challenges that you might have so that you can do those activities and still be a part of them. We definitely want our patients to get good sleep. Very important to be on a good sleep routine, going to bed at the same time, waking up at the same time every day. I have rest breaks there. Rest break does not equal nap. So we want to make sure that you can take a nap, that's fine. I'm always up for a good nap every once in a while, but what we don't want is napping so much that it impacts your sleep at night. So I encourage people to, take rest breaks as opposed to naps. So going to a quiet, dark space and just closing your eyes, doing some deep breathing, meditating, whatever you want to do, to kind of bring those symptoms back down and then go back to, your activity. What I generally say is follow the rule of 3. So if you have 3 symptoms that have started to get worse, headache, fatigue, maybe dizzy, you got to take a break. You can't just tough it out. And you'll find that if you start taking breaks more regularly, your endurance actually improves because you're not overly tiring yourself. And you're not just running that gas tank on empty the whole time. Okay, so this one's probably the hardest, the hardest one because I think we all just really want, a magic pill that's going to make us better instantly. But I think we all need to recognize that recovery is not linear. So you might have a good day, you might have 3 good days, but it's no guarantee that then you won't have a hard day kind of following that. And you might need to take a step back, take a few more rest breaks to recuperate. It doesn't mean that you're taking a step back in your recovery. It doesn't mean that you're not improving over time if you have a bad day. That said, if you have more bad days than good days, then I think you might be overexerting yourself and it's time to kind of look at what you're doing in your daily life. But just know, everyone is different. Everyone has different symptoms. Everyone has different responsibilities in their life. So everyone's trajectory for recovery is different. But just knowing that you are not alone, that a lot of people are going through this, and that there are resources out there that can help you, hopefully will help keep you, on the right track, on the up and up. So looking towards the future, there are tons of research studies going on right now. The National Institute of Health and the National Institute of Neurological Disorders and Stroke Research are exploring potential connections between the effect of COVID-19 and on blood vessels in the brain, and also on the effects of the lining of the intestine, and how those might be impacting chronic cognitive symptoms. The Institute of Neurological Disorders is also investigating new tools to understand the biological effects of COVID-19. So again, we're thinking about MRIs, blood biomarkers, things that we can have to more definitively diagnose long haul COVID, and also investigate why COVID-19 seems to affect some people more severely than others. The National Institute of Health has a program called Researching COVID to Enhance Recovery, or RECOVER is the acronym for that initiative. And it is a national patient-centered effort to understand the causes of long COVID and advance discovery of treatments for long COVID. So that's very exciting. And, I would encourage you, if you are experiencing long COVID and you want to look into some of these research studies that are happening, you might be a candidate, and you also might be able to get access to certain, treatments and medical support that you wouldn't normally otherwise get to be part of. So it takes all of us. So if you're interested, I think there's a lot of really good resources out there. And I would say if you go to, the National Institute of Health, NIH, with the U.S. Department of Health and Human Services, they have a, website you can look at and see what clinical trials are out there. I also wanted to leave you some other resources that are out there that can be helpful for people. So the ACL, or Administration for Community Living, has a ton of resources for people experiencing long haul COVID. The Centers for Disease Control, or CDC's website, has a lot of kind of research studies, current numbers, facts, things of that nature. If you are experiencing symptoms of long COVID and you are working or wanting to get back into the workforce, the U.S. Department of Labor's Office of Disability Employment can be really a useful tool in having those conversations with your employer. As I mentioned, the U.S. Department of Health and Human Services doing a whole bunch of research projects. And then, as a healthcare provider, North Kansas City Hospital, we try to do things like this program to help educate the community. We offer therapy to help address some of those complaints that I spoke about earlier: speech therapy, occupational therapy, physical therapy, and just a comprehensive healthcare team that can help support you as you navigate through this journey. So that being said, I will open it up for any questions.
Feel free to drop those questions in the chat, or there's a Q&A box there too. Well, I've got a couple questions.
Yes, go for it. I will try my best to answer.
When they come to you for this cognitive therapy, can you give us an example of what we might expect when we're coming in? Like, what would we do for a chronic cough? How would you work with me if I had chronic cough and long COVID?
Yeah, so if you have chronic cough, well, first and foremost, we always do kind of a patient-centered assessment, like you rate yourself on various scales. So we have a chronic cough scale, and that would allow us to see, how is this impacting your life? Are there specific times when the chronic cough is worse or better, what seems to be triggering. We talk about history, just general medical history, but then also just specifically history with the cough. And then we teach different suppression strategies. We kind of do some tracking so that you can maybe identify some patterns of the chronic cough at home. And, yeah, just kind of do different things that are going to help you be more aware of those triggers and what you're feeling, and then try to suppress the cough safely. So one of the things that I tell patients that is kind of surprising, I guess, for some of them, is that unless you are actively sick and you're coughing things out, there is no physiological benefit to coughing. And so I think sometimes people are nervous to suppress a cough, but it's actually just like a vicious cycle, and we've just got to break that cycle. So chronic cough therapy is becoming a lot more prevalent. I get a lot of referrals from pulmonology for patients that have chronic cough.
I didn't even know such a thing existed, that you would have a therapy for a chronic cough, but I love that.
Yeah.
So if they want to do therapy, am I correct? Like even speech therapy, do we need a referral for that?
Yes. So I should have said this, but therapy is generally covered by most insurance companies. We do just need a doctor's order, but it can be any doctor. It doesn't have to be a neurologist or a specialist. It can come from your primary doctor. And generally, we're able to get patients in within 1 to 2 weeks at the most. So we're able to start and get going pretty quickly. We have a great team of reimbursement specialists that go through and check everyone's insurance before they come in, so you don't get any surprises. And yeah, and it is something that most doctors really don't hesitate to refer because they've seen the benefit. So it's just a good thing to bring up at your next appointment if you are interested in that.
And I know that if you use a patient portal, you can always message them through that. Or always call and just leave a message for the nurse. I've had success with that because I know those physicians are often so busy in and out. Same thing with a dietary referral. If you want to see a dietitian, you do need a physician's order for that. But again, that could just be a quick call to the office to make that happen. What else? Oh, I like how you mentioned the exercise bit. So oftentimes, like what I do in my role too, is to promote health and wellness, and people need to exercise and move their bodies. And I think a lot of times when I'm saying you should go exercise, people go, ugh. And it doesn't have to be this giant powerlifting session at the gym. It can literally be you cleaning your house a little more, an extra vacuum, a walk around the yard, picking up sticks. So things like that, just trying to think outside the box of what activity really means.
Yeah.
Exercise is almost a bad word nowadays.
Right. And that's part of what we do, in our therapy sessions, is we kind of brainstorm, what can I do? What are my goals for this week? What am I going to focus on? And how can I accomplish that? So maybe your goal is I want to get more, physical activity in. So we'll kind of plan that out and try to help patients achieve those goals.
Right. Okay. What else? Oh, your support group. So where do I find information on that, Stephanie?
Yeah, so I should have said the support group is brain injury support group. If you are experiencing any kind of brain change, including long haul COVID, you are more than welcome. You do not need a specific diagnosis to be part of that group. And in fact, I would say if you look at the populations, long haul COVID and concussion actually have very similar symptoms. So it's very likely that you could learn a lot from going to that group. And so you can go to the North Kansas City Hospital events page. It happens monthly, so the third Thursday of every month, and it is from 7:30 to 8:30 p.m. It's completely free. You would just sign up with your email address, and then you'll get the link for that. And actually, this is perfect timing because it will be this Thursday next. So, and if you have trouble finding it, I will also leave my email address here. You're more than welcome to just email me directly, and I'll make sure that you get on the list.
So that the same way that you signed up for this, this presentation today would be the same way you would sign up for that support group. So you would just search that on our webpage. So that was a great segue because I just wanted to throw out, we have a tons more education similar to this. And you can always sign up for that on our webpage, which is nkch.org, and you go to the events tab. There's some filters in there so you can play with it. Also, lots of great videos on our YouTube channel. So if you go to YouTube and search North Kansas City Hospital, you're going to find lots of content. Stephanie's been presenting for us for years. She
Yes.
is our brain gal. So I love always listening to you present. I think you're a great presenter and you're so knowledgeable. Go back on that YouTube channel and you can search the Amazing Brain series. Lots of stuff there too. But yeah, Stephanie, thank you so much.
Yeah. Absolutely. My pleasure.
All right, guys, hope you have a great summer. Thanks for joining us. If you registered for this, we will send you an email with the link for the YouTube video because we will throw this up there later, or if you wanted to watch again later. And again, yeah, feel free to email Stephanie and check back on our website for more info. I hope you guys have a great day.
Thanks.
Bye.
Bye.